Hello friends, in the current video, we are going to study about the topic of diabetes mellitus. It's a comprehensive and in detailed overview regarding this condition. So let's begin with the introduction. Diabetes mellitus is a chronic metabolic disorder which is characterized by persistent high glucose levels due to insufficient insulin production or insulin resistance or both. It is affects multiple organ systems and requires long-term medical attention. So there are a few types of diabetes mellitus which we need to learn. So there is mainly type 1 and type 2 diabetes mellitus which are more significant, and there are another types of diabetes mellitus also present which are known as gestational diabetes mellitus, which is usually seen in pregnant women and during pregnancy, and there are other type of diabetes also which is known as which occurs due to genetic defects or pancreatic diseases or drug induced diabetes mellitus. So let's understand what are the type 1 and type 2 type of diabetes mellitus. Type 1 diabetes mellitus is a autoimmune obstruction disorders. In this case, what happens that pancreatic beta cells leading to absolute insulin deficiency. It means that whatever the pancreatic beta cells present in the patient, they are unable to produce a required amount of insulin. Because of this, insulin deficiency is seen in the patient and the patient develops type 1 diabetes mellitus. So and now start learn about what is type 2 type of diabetes mellitus. It is a progressive insulin resistance combined with relative insulin deficiency. In this case, what happens that the insulin which is produced in the patient is unable to utilized by the cells of the patient. So because of that, the patient shows high blood sugar levels in their body, and it also sometimes occurs with the relative insulin deficiency production in the patient. And now we will see what is gestational diabetes mellitus. In this, it is a glucose intolerance first recognized during pregnancy. During pregnancy, if the blood sugar level of the pregnant woman is more, then we call it as gestational diabetes mellitus, and it is induced during because of during pregnancy. It is a pregnancy induced diabetes mellitus. So it is only seen in women, and there are other types of diabetes mellitus which can occur in the patients that can be genetic. Sometimes in the family, the elderly person, if they are having diabetes, then the family members also can get diabetes as a genetic defect. And if the patient develops any kind of pancreatic disorders, because pancreas is the organ which plays a vital, which is the main organ which produces the blood sugar controlling in hormone insulin. So if because any disease occurs in the pancreas, then it will pathologically it leads to less insulin production, and the patient develops altered blood glucose level and high blood sugar. So can occur can be a disease of diabetes. And sometimes because of few drugs also, the patient take few drugs, that also affects the insulin production in the patient, and the patient develops diabetes mellitus. So these are different types of diabetes which occurs in the patients, and what are the reasons why they occurs and why we call that type of diabetes mellitus. So now in this slide, we will study what is the epidemiology of diabetes mellitus. Diabetes mellitus is one of the most common, and it is a non-communicable disease globally. So diabetes is a chronic disorder, but it is non-communicable, means it is not occurs to the next person. It don't pass like that. If the patient is having, he only suffer with the disease. Don't affect the friends and whoever come in contact with the patient, affecting over 500 million people. So most of the people of the global population, they have diabetes mellitus. and its prevalence is rapidly rising due to sedentary lifestyle, obesity, aging populations. Because of here we also study how many people are currently affected with diabetes mellitus, and we also understand what is the prevalence, because it is in the it is rapidly rising, because most of the people nowadays they depend on the machines, and they do less exercise, they have a sedentary lifestyle for hours together, and they also get obesity, and because of aging also they develop diabetes mellitus, and it contributes to the prevalence of the disease. So now we also in this slide we will see what are the causes and risk factors of diabetes mellitus. So major risk factors include genetic predisposition, as we mentioned earlier. If genetically it is present in the patient's family, then also it is easy to get that disease in the other members also. If the patient is not maintaining, his obese, do less physical activity, have poor dietary habits, advanced aging, and stress also sometimes in patients, it causes the risk factor for diabetes. They start showing symptoms of diabetes mellitus, and because of some associated conditions such as hypertension and dyslipidemia also can cause diabetes mellitus. So now let's study about what is the pathophysiology of diabetes mellitus. As we studied in type 1 type of diabetes mellitus, it is autoimmune destruction of beta cells because of some because their own genetic response. Some beta cells of the pancreas get distracted. Because of that, insulin production in the patient get decreased, and the patient develops diabetes mellitus, and it also leads to absolute insulin deficiency, and the patient develops type 1 diabetes mellitus. And what is type 2 diabetes mellitus? It is insulin resistant in peripheral tissues. Whatever the peripheral tissues are the impaired insulin secretion and increased hepatic glucose production. So in type 2 diabetes mellitus, what happens is that whatever the mainly peripheral tissues, as patients foot or appendages, they unable to utilize that insulin and control blood sugar in that areas of their body parts. Because of that, and other body parts also, they unable to utilize insulin. They become insulin resistant, and then they show high blood glucose level in the blood. So, and they develop type 2 diabetes mellitus. So diabetic foot is mostly seen in type 2 diabetes mellitus, and because of sometimes it also occur, it is also happens together with impaired insulin secretion also, and and in type 2 diabetes mellitus, there can be abnormal hepatic function also, and there we can see increased hepatic glucose production in type 2 type of diabetes mellitus. So this leads to chronic hyperglycemia. Hyperglycemia is the terminology which is used to express high blood glucose in the high patient. So and it stays for chronic period. So this is the difference between type 1 and type 2, mainly complete understanding about type 1 and type 2 diabetes mellitus. Type 1 is is an autoimmune destruction of beta cells, whereas type 2 is insulin resistance by the tissues and cells to utilize it. and reduce blood hyperglycemia. So what are the clinical features? These are the clinical features we see in the patients who have diabetes mellitus. They come with these problems and they complaints. They are polyuria, which means increased urination. They have complained of that we have to go to the toilet for a number of times because at the night also they have to get up and go because so these all symptoms they will show for of polyuria, and sleep disturbances also may be seen in the patients who are having high blood sugar and diabetes mellitus because of polyuria. And another symptoms they will show that polydipsia. Polydipsia is increases because it is also related to the polyuria because more amount of urine, more amount of water they lose from the body. That's why psychologically they will feel the dipsia, increased thirst, and polyphagia. Polyphagia is also a condition which is seen in diabetes. Polyphagia, they feel they are having more hunger and they want to eat more. This type of thing is seen in diabetes mellitus. And unexplained weight loss. Unexplained weight loss. In some patients, we see unexplained weight loss, and in some patients, there is a symptom of weight gain also. And fatigue, they also have the symptoms of fatigue, blurred vision, and recurrent infections. So if blood glucose level in the body is not controlled, then they are more prone to get more infections, different kinds of infections that can be superficial infections also or internal infections also. And inflammation can be seen in the individuals because of this bacterial effects. So these are the main clinical features. They are polyuria, polydipsia, polyphagia. These are the clinical features seen in the patient suffering with diabetes mellitus. Sometimes unexplained weight loss or weight gain also seen in some types of diabetes mellitus, fatigue, blurred vision, recurrent infections. Patients suffer with recurrent infections. So sometimes the patients come with unknown infections. They don't know why this injury occurred in their on their appendages or somewhere. So idiopathic infections also so diabetes mellitus is also a cause for this idiopathic infections and injuries to the individual. They feel as it is an injury, but this occurs because of recurrent infections due to diabetes mellitus. So how to diagnose diabetes mellitus in the individuals who are suffering with high blood glucose level? So fasting plasma glucose. If a patient is, it's fasting blood plasma glucose. If a patient is having fasting, they did not have their breakfast, their lunch, nothing, they had dinner, with empty stomach, if they are having a blood glucose level which is greater than or equal to 126 milligram per dl of plasma deciliter in their blood, we call it as criteria we can understand the patient is suffering with diabetes mellitus. And if we are testing random plasma glucose, if randomly we don't know whether the patient had food when and what time, but if we don't consider that, we are testing randomly and we want to know what is the blood glucose level of the individual, and if it is greater than or equal to 200 milligram per dl with few symptoms that they say they are feeling thirst, they have a weight, they are getting weight gain or weight loss, and then it can be because of blood glucose level, and if it is more than 200 milligram per dl with polyuria, polydipsia, polyphasia, we call it as diabetes mellitus. And another test we can do is oral glucose tolerance test or OGTT test. After OGTT test, in this test, after taking glucose, after 2 hours we test the individual's blood glucose level. If it is more than or equal to 200 milligram per deciliter, we confirm it as diabetes mellitus. And another test, HbA1c, is also test which can be done to diagnose diabetes mellitus. If it is greater than or equal to 6.5%, then also it is confirmed as diabetes mellitus. So, these are all the tests which are required to diagnose diabetes mellitus for their diagnosis, and confirmation is required on a separate day unless unequivocal. So confirmation, yeah, at one, it means that at once if we test diabetes mellitus and we see there is any whatever these things are there, if we see in the individual and high, it is more than 126, 200 or 200 milligram per deciliters, or it is more than 6.5. At once we don't confirm it as diabetes mellitus. We repeat the test after a few days, and after few days we repeat the test, and in every day if it is coming in these parameters, we confirm it as diabetes mellitus, because it can be acute also sometimes in some patients because of stress or some other reasons. They show high blood glucose level, but it should be chronic and persistent, then only we confirm it as diabetes, as it is a chronic condition. And what are the complications of diabetes mellitus? Microvascular, and in microvascular complications which can we see in diabetes mellitus are retinopathy, neuropathy, and nephropathy. So nephropathy, at microvascular level, retinopathy, some eye disorders of the patient, diseases they can develop. Kidney nephropathy, some kidney diseases also the patient can develop, and neuropathy, some neurological disorders also the patient can develop. And another is macrovascular. What are the macrovascular complications which can seen is coronary artery diseases, which can lead to cardiac dysarrhythmias or some other conditions. And another is stroke, peripheral artery diseases. Peripheral artery diseases, stroke can be any kind of stroke they can develop, and peripheral artery diseases also can be seen in diabetes mellitus. And other complications, as we see in diabetic patients, are diabetic foot, which is most common, and most patients mostly they suffer with this problem and conditions. And other are infections. Poor wound healing is seen because of high glucose levels, because they are prone to get bacterial infections and other kinds of infections. Cellulitis mostly occur because of. So to treat all this, first we have to control the blood glucose level through different kinds of treatments, insulin therapy or medication. First we have to control blood glucose level of the patient, then if it then simultaneously or after, we have to treat those infections. Diabetic foot, poor wound healing can be treated. So management overview here. Effective management includes lifestyle interventions. Lifestyle interventions plays a very vital role in controlling diabetes mellitus, because it occurs because of poor dietary habits, and because of a sedentary lifestyle, not doing exercise, and of all those conditions. So if proper lifestyle interventions are adopted by the patient, they can control their blood glucose. If they start doing exercise, then they can control their high blood glucose, this condition, and it can be managed effectively. And if they are unable to do that, then pharmacological treatment needs to be given. If it is not controlled with all these interventions, then pharmacological treatment is given. Regular monitoring is also required to understand how much the body of the patient is having tolerance with this disease, and how much he is being affected. Uh, he or she is being affected. And patient education, we have to teach the patient how they can manage, what they have to eat, what dietary regulations they have to follow to soothe their body functions in controlling the blood sugar level, hyperglycemia. We have to educate the patient, and prevention of complications. So we also explain the patient how to prevent whatever the complications which can occur because of this chronic condition. So what are the lifestyle modification needs to taught to the patient are that a healthy diet. We have to explain the patient take high in fiber, low in refined sugar and saturated fats. Means we have to ask them to take a high fiber rich diet, and take refined sugar, reduce the sugar levels, and if they are take only refined sugars. And we also ask them don't take saturated fat, don't take unsaturated fat. We have to explain this to the patient. What is the physical activity? We have to explain the patient to do physical activity minimum of 150 minutes per week. 150 minutes. 150 minutes means more than 2 hours. They have to do more than 2 hours. They have to do physical activity, which improves their lifestyle, and it can leads to less blood glucose in their body. And we have to ask them weight management. They should target BMI is 18.5 to 24.9 kg meter square. This is the target BMI. They should have a target BMI of this much. So they have to manage their weight. And another thing is that smoking cessation. If the patient they have a habit of smoking or alcohol drinking, they have to control that and avoid these things, so that it is not good for healthy lifestyle, so they can quit these unhealthy lifestyles, those few lifestyle modifications to stay healthy. So now here we will also study of what is the pharmacological treatment given to the patient. Oral agents, as we know, metformin and sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors are given to the patient. Few injectables like insulin, GLP-1 receptor agonists given to the patient. Combination therapy required for optimal control. Sometimes some combination therapy also can be given to control. Both injections and oral agents are given to the patient. Here we will study about what is insulin therapy. There are different types of insulin therapy. One is rapid acting insulin therapy, or short acting insulin therapy, intermediate insulin therapy, long acting, and premixed insulin therapy. Indicated in type 1 diabetes and uncontrolled type 2 diabetes, which is given both in type 1 and type 2 diabetes mellitus, required regular monitoring and dose adjustments. Here what happens that if the patient, different types of insulin therapy is given, which can be rapid, short acting, intermediate or long acting or premixed, according to the patient's complaints, according to the patient disease, and what is the patient suffering with. And but if this treatment is given, it should be monitored regularly, and sometimes if because of the response, as per the response of the patient, the dose needs to be adjusted. It is both response, how the patient shows about tells about his complaints and his how his cure, how he explains about that, and also about the after seeing the reports of their blood glucose level, the dose needs to be adjusted. Dietary management, whatever the patients they comes to the hospital or in their home also, we have to manage diet of the individual. We should understand we should make understand the patient that have balanced meals, portion of the amount of food they take per day, they have to control that. Whatever the amount of carbohydrate they are taking, we have to ask them, and we have to say them watch their carbohydrate food intake, and use of glycemic index to choose low GI foods. And we have to ask them use we have to control their glycemic index also to choose low GI foods. So low glycemic foods they should uh, take, which have less amount of carbohydrate. So these we have to focus on these dietary managements in the patient who are having chronic condition of diabetes mellitus. What is the significance of exercise and physical activity? Aerobic exercises like walking, cycling, swimming, and resistance training improves insulin sensitivity. Flexibility and balanced exercise recommended for elderly patients. So if the patient is of less age, we have less age or not geriatric, then we can not geriatric, and we can say them do walking, cycling, swimming, etc. And then if they are elderly, then whatever the flexible and balanced exercise they can do, we can tell them to do, though we can teach them to do those exercises and physical activity. We are self-monitoring and glucose of blood glucose. In diabetic patients, it is also plays a key role. We can teach them how patients, chronic patients, as they are chronic, for every monitoring, if they cannot come to the hospital or the clinic, we can tell them we can they can self monitor their blood glucose levels, enables timely adjustment in therapy. They are noted down and show next times they come as a follow-up to their physician. Prescribe recommended frequency, daily for insulin users. If they are having they are insulin users, they are on injectables then we can ask them, do you monitor your blood glucose level regularly, daily? And if they are weekly or bi-weekly for stable type 2 patients. If they are stable and type 2 patients, then they can monitor their blood glucose weekly or bi-weekly. Means in 7 days or in 14 days, they can test their insulin, their blood glucose level. Patient education. Patient education is vital for adherence, early detection of complications, and effective self-management strategies. It means that if patient is educated about this disease, they they maintain their lifestyle, they early detect this disease, and they prevent further complications, and they develop effective self-management strategies regarding the disease. How to prevent diabetes mellitus? So this comes under this prevention. So primary prevention happens because of healthy lifestyle. If any individual they have and they maintain healthy lifestyle, it's primary prevention. Secondary prevention is if secondary prevention, what we call secondary prevention is early detection via screening. It is secondary prevention, means screening is also important and comes under secondary prevention. And what tertiary prevention can be done? Preventing prognosis and complications. Tertiary prevention, what happens that if the patient develops diabetes mellitus, then we have to control its prognosis and complications. So these are three types of preventions: primary prevention, secondary prevention, and tertiary prevention. Primary prevention are mostly adopted in the younger individuals. Secondary preventions are followed in those patients who are prone to get diabetes mellitus, and tertiary preventions are followed in the patients who develop diabetes mellitus or who have some risk factors to develop this disease. Then tertiary prevention is followed in those patients or who already developed the disease, geriatric patients or some other patients who are chronic patient of this hyperglycemia, of diabetes mellitus. Tertiary prevention is followed in those patients. So in recent advances, in recent cases, what happens is that continuous glucose monitoring, which is also known as CGM, flash glucose monitoring, artificial pancreas, and novel anti-diabetic drugs like dual GLP-1 agonists came into existence. Some artificial pancreas is also developed. Flash glucose monitoring. These are few advances, recent advances we saw in this controlling of this disease. Prognosis. Prognosis of the disease depends on glycemic control, comorbidities, and patient adherence. So, why it happens? Why it happens complicated in few patients is that if they don't control their blood glucose, and if the patient is having some other related disease also with this disease, and the patient how they treat themselves, how they follow the treatment regimen, and how they follow the follow up. These all paves the way in the prognosis of the disease. If they don't follow properly, they don't control, they have other conditions with the disease, they don't want to treat themselves, they don't do lifestyle changes, they don't do exercise, then the disease can then it will leads to prognosis of the disease. So with proper management, complications can be minimized and life expectancy is improved. We can control the prognosis of the disease. So at the end, let's conclude the topic. So diabetes mellitus is preventable and manageable conditions with early detection, and lifestyle changes and appropriate treatment. So we can prevent diabetes mellitus if it is we can manage also with early detection. We have to detect it early. If we introduce few lifestyle changes in the patient's life, then also we can control the disease. And if the patient develops the disease, then also it can be treated pharmacologically and dietary changes.